There has been a huge development during the last decade regarding transgender persons. First of all, I think the knowledge of this variance in humans has become much more widespread, probably due to the internet. So more people are coming out and more people seek help. Also, we can see that the picture is not as black and white as we thought. To be a gender incongruent person is to be within a spectrum of many different identities. So care for these people needs to be much more differentiated than we used to believe before.
So lately, I think our focus has shifted to providing patients surgical options that fit in with their personal priorities and risk tolerances, to provide them some options that can reduce some of the complications that are traditionally associated with some of these surgeries. We've stepped away from a one-size-fits-all approach, and now there are a range of options available to patients seeking surgery. For example, someone who desires vaginoplasty may not necessarily prioritize the ability to have vaginal receptive intercourse. So we're seeing more and more patients who see shallow depth vaginoplasty as the best of both worlds. So achieving the same external female-appearing genitalia without the commitment to lifelong vaginal dilation. On the masculinizing side, the vast majority of the complications associated with the traditional procedures, phalloplasty and metoidioplasty, come from the urethral lengthening portion of the procedure, which allows patients to urinate while standing. So for those patients who do not prioritize standing to urinate or just do not want to have the added risk of complications, they can have the same surgery without urethral lengthening, and that's a great option for them. So they get a penis that's identical in appearance to one that has urethral lengthening, but the urethral opening is hidden behind the scrotum, and the risk of urethral complications is virtually eliminated. So shallow depth vaginoplasty and phalloplasty without urethral lengthening are not the right choices for every patient, but for those patients whose priorities align with what these surgeries offer, they're valuable alternatives. Furthermore, we're seeing an increase in requests for more non-standard or non-traditional gender-affirming surgeries, such as phallus-preserving vaginoplasty, vagina-sparing phalloplasty, and genital nullification. These can be great options for patients who identify as non-binary and further expand the options that are available to patients who are seeking gender-affirming care.